Time for another episode of Pottawattamie County Roots. Hi, I'm Todd Studer. Next week, all across the country, it is National Health Week, and in Pottawattamie County, they are taking part as well, and we are going to learn more about it from our county epidemiologist. It's Candy Steenbock, who is back in studio today to tell us what the county is doing and some of the different things that you can see and be paying attention to as we move forward with National Health Week next week. So Candy Steenbock, county epidemiologist, is joining us today on Pottawattamie County Roots. If you are looking for all natural health solutions in Southwest Iowa, it's Bambi's Green Acres Natural Market. She's at 805 South Main Street in Council Bluffs and has a wide selection of vitamins, supplements, essential oils, herbal remedies, everything that you need to put health back in your hands. Learn about your wellness options online at bambisgreenacres.com. And a leak, a clogged drain, or a big remodel, that is why Waldstein Plumbing is here. They've got you covered with fast, reliable service and expert craftsmanship, handling everything from small repairs to major installations. They're locally owned and trusted and take pride in doing the job right the first time. So, to schedule an appointment, go to waldsteinplumbing.com. This is Candy Steenbock, and she is an epidemiologist with Pottawattamie County Public Health. Good to see you again.
Yes.
Thanks so much for coming over. You've been busy. You've got a lot of plans going into a big event coming up next week, right?
Yes. So we are honoring the National Public Health Week. So that is taking place next week, April 6th through 7th, 8th, 9th, 10th, right?
Right.
Basically, it is a week that is recognizing the impacts of public health. It is a national movement through APHA, which is the American Public Health Association. And the theme this year is Ready, Set, Action. So that's a lot of fun.
What does that mean?
So in the context of the week, next week, it's really kind of diving into the different public health actions that go into the benefits that we reap every day. So they're going to kind of do a different topic each day. It's going to focus from government actions, local actions, legislative actions, individual actions, and really just those behind the scenes things like preventative work that you don't necessarily see in public health, but you benefit from it every day.
I was going to ask you about that. What does this bring just the average person like me?
Mm-hmm.
What does that mean for me with all of this work that you're doing?
Yeah. So more broadly, I would think about the different actions like the clean water. There were laws and actions by individuals to make that possible. Immunization laws, while sometimes controversial, they really do have an impact on communicable diseases. Cleaner environments. We have our environmental health team that does a lot of the environmental health hazard and regulation and enforcement. It's huge. Those actions prevent like failures with your sewer system, or I should specifically say your septic
Mm-hmm.
in the county, and then your private well water. So really, to the average individual, there are some actions that I take. So my communicable disease outbreak investigations, you might not see that, but I'm protecting your individuals that are in a long-term care facility, trying to prevent the spread of outbreaks there and really kind of keep things down. But also on an individual level, there's a lot of actions you can take that are influenced for public health. So not contaminating public water, immunizations, right? And staying home when you're sick. So there's a lot of individual actions that we can take, but it kind of goes as far as your individual health too, and the public health initiatives that are out there for nutrition, physical activity, all the fun stuff.
I am thinking back. See, I'm of the generation that a lot of these things that you're talking about were barely mentioned back then. I had somebody here just recently, and we were talking about this. You know, when I was a kid, you finish up with lunch or whatever, and we were instructed by our parents, throw it out the window.
Yeah.
You know, with no concept at all of, you know, this is actually bad for the environment. There was styrofoam in there and different things like that. We just did those things back then. But we've learned a lot, not just in that area, but of everything you're talking about with clean water and with septics. And we know a lot more, so we're able to keep everybody a lot healthier.
Yeah. Yeah.
So how does that translate into your work
Yeah.
during that week. What are you specifically going to be doing?
So we'll do a lot of the promotion of the National Public Health promotional activities. So if you don't already follow our social media, we'll put a lot of that out on Facebook. There's going to be the different activities that we highlight each day, and also really just promoting the services that we do offer. So the public health actions that we take nearly every day are going to range from our communicable disease activities, but our in-office services like the testing, the WIC clinic that we have, the immunizations we offer, really just promoting what we can offer our community.
How well do you think the community knows about everything that you offer?
We really try. I went to the town hall last week and did a brief overview and brought some promotional materials for some more of our rural citizens. But in general, I don't think people know what public health does. And I hope with the help of our promotions that we've been doing and having our conversations with you that really are different. We have so many different wheelhouses and really how it impacts our community. A lot of people think of public health and they think broadly, and it is broad, it is population health based, but there are a lot of things that we do that do impact individuals. So getting that information out there is huge, and not enough people know about it. So that's another thing we're working on all the time.
And this is really designed for everyone, right? Yeah. That everyone has access to this. Yeah. This is, and sometimes maybe it's just information.
Yeah.
That could be really beneficial too. And but at any time that I get a chance to talk to you or anyone else that's working in your building, I'm usually surprised. Wait, you do that? That that comes up quite a bit with me.
Another new thing. And another thing that we're doing with the week next week is a Keep It Moving challenge. So we'll make sure to share information on that, and it'll be a fun physical activity challenge. So.
That, well, I'm just now getting back into that myself. Yeah. 5 a.m. this morning, I was at the gym.
Impressive.
That's the only time that I have, to be able to plug that in.
I was enjoying some sleep while my baby slept. So.
Well, that would be
priorities. Right now,
yes,
those are my
but also
that's health for me.
Exactly. It's sleep is very, very important when it comes to that. And when you have when you have a young child at home, you need to take advantage. If the child's sleeping, yes, that's how that works. So all of this coming up, and you've been putting a lot of prep into all of this to get all of that done, and not just you. There's other people involved with that too, and I think we've got a pretty good team together with County Health, wouldn't you say? Yeah,
we have a great promotions coordinator. He has been working and gathering a lot of the materials that are going to be promoted next week, both in-house organic posts, but also sharing those national messages. So
a lot of this tied in with what's coming from national, that just making it fit for Pottawattamie County. Is that the concept?
Yeah, we'll share a little bit of both, and we also picked pretty much our own spin on it to make it a little bit more of call to actions. Some of the messaging that they were sharing was more broad, so we're just doing a few more posts that will be specific call to actions and information for our citizens.
Platforms that you're going to be on that people can follow you?
Mainly it's going to be Facebook still right now. And the Pottawattamie County main website will share some information as well.
Now, wait a minute. I was told by all the experts that your generation isn't on Facebook anymore.
We sure are. Public Health uses Facebook as our main platform.
Yeah, and I have seen that myself, too, because I can see with views that come in on this show, and it'll break it down in the analytics about different age groups. And, there are people your age in there. I don't know where all of this is coming from that think that no one is using Facebook anymore. And to me, that's just not the case. I can tell you that I'm not really good at Snapchat. So I'm pretty bad at that. But there's a lot of great information that's out there. And this is what I love social media to be used for.
Absolutely.
Because there's a lot of negativity out there. So let's flood it with the positive stuff and see if we can't drive some of that negative out. And a lot of the work that you're doing, I think, fits right into that. Are you hands-on and posting every day? Is this going to be you or just somebody else in the office?
It'll be Logan. He's our promotions coordinator. He does the main coordination on our Facebook page. But a few of us will probably attend the proclamation, so keep an eye out for that. That'll be Tuesday.
That's coming up on Tuesday?
Yep,
so what's involved with that?
The board will proclaim it as National Public Health Week officially for Pottawattamie County.
So that's the Board of Supervisors.
Yes.
Happening at that weekly meeting.
Yes, on Tuesday the 7th.
On Tuesday the 7th. So a lot going on, and you always very gracious with your time when it comes to stopping over. Anything else coming up in the future that we want to highlight, or is your focus just simply on Health Week next week?
Well, I do want to plug that I just left a Board of Supervisors meeting. They did another proclamation for Child Abuse Prevention Month. So they declared April as Child Abuse Prevention Month. And if you see the blue pinwheels around campus or just kind of in town, other organizations will post them. That is what that signifies. So important cause, of course, and really taking our actions. Our different agencies serve children and families, so it's very near and dear to us.
Yes, exactly. So again, thank you, Candy, for your time and for all of the hard work that you're putting in. And yeah, I get it. It's your job, but at the same time,
it's my daily. But when you sit down and think about it, not just myself, but all of our great staff and the impact that we do have that you don't always see, but you benefit from is huge.
All right. Well, anything coming up, you let us know so we can help spread the word from just our corner.
I'm sure
here.
One of us will be back in May. There's another proclamation.
Yeah, I think that we've been working and getting, Kate's been getting me all the information over for everything going on in the county. And I now have almost weekly coming out with different things going on in different parts of the year. And she did a lot of work putting all of that together. And you guys are a big part of that. So grateful as always.
Yeah.
And looking forward to seeing you the next time.
Great. Thank you.
Service Master Restorer by Schmader knows how hard it is to get things back to normal when you've suffered serious property damage due to flooding, fire, or smoke. Maybe you've been left with mold problems or any other number of disaster things that could be taking place and leaves you with all sorts of questions. How am I getting things back to normal? Well, here's how you do it. You call Cindy Schmader with Service Master Restorer by Schmader, and she can help you all across Southwest Iowa. Call 402-339-9911. And if you're in the market for stylish, locally curated fashion that's close to home, visit Unique Boutique Iowa in Neola at 101 4th Street. You'll find trendy clothing, accessories, distinctive gifts, open on the weekends, but you can shop anytime online at shopubiowa.com. Unique Boutique Iowa, distinctive styles, heartfelt service, right in Neola. Thank you again, Candy Steenbock, for joining us today. Always great to talk with you, and looking forward to having Candy back real soon. My name is Todd Studer, and we'll see you back here tomorrow morning